I'm a triple Buckeye, and that means that I went to Ohio State for undergrad, medical school, and now residency. Ohio State is just a huge part of Columbus, and actually, you know, for the rare few of us who get to stay for so long, becomes part of your identity. And it was really hard to leave, and the Ohio State Medical School was world class, and you learn about all these different kinds of things. I chose urology ultimately because it was one of the most dynamic fields where we get to operate on the robot and use a lot of emerging biotechnology and do endoscopic cases, open surgeries, office procedures, all kinds of things. And you know, specifically our program had everything that, you know, I needed to be an excellent community or urologist and go out there and take care of the patients that need urologic care done. And I knew for 100% that Ohio State Urology would give us the best surgical training in the country. And but beyond that, it has all the tools that you need to become a leader in the field too. From a research perspective or an advocacy perspective, Ohio State, you know, we have the faculty and the connections to do, take it any route you want. Ohio State is part of my blood, has been for over a decade, and it was a no-brainer.
I think the reason why I decided to come here to Ohio State really was a lot of different things. I mean, the residency program at Ohio State, my urology residency, has really shown to be just like very supportive. I really think that the camaraderie during my interview day really just shone, and I didn't feel that way about all the other programs that I interviewed with. This program seemed like it was the right fit for me, and I just felt that in my gut on my interview day. I think really the other thing that really stood out to me was how much they supported the residents on things that were not clinical. We have a really, really robust education program, and as someone who is very passionate about education and that's something I want to do as my career choice, this is absolutely something that was so important to me, and I liked that we had so much protected education time. The other thing is that as a female going into urology, we had really important representation here at Ohio State about women in leadership, as well as residents represented and faculty represented who are women. So that really, for me, was an important driving force as well to why I really thought Ohio State was the right choice for me.